All right, so a very good morning to Queen Darling, wherever you are, Charlie. Today I'm missing you so much here. Ministry is taking you around, and when you say good morning wherever you are, keep doing what you're doing, and very soon I know you join me next week. All right, so it's time for me to introduce my guest, and on my immediate left I have Alison Amate. Yes, Alison Amate is a nurse from the Trust Hospital, and she's part of the Pink October team, and she's in the studios with us. And to my extreme right I have Dr. Cassandra Odum. She's the general practitioner, also from the Trust Hospital, and she's also part of the Pink October as well. You can see them in their Pink October shirt. Let me see, you have Pink October Breast Cancer Awareness Month. It's good to have you both here.
Thank you.
Right. I never dreamt of a day where I'll be interviewing, doctor and nurse on breast cancer, because more often than not, the men think that, oh, okay, so we are, they're breast cancer, them. But, I find myself in the middle of this interview, and I'm excited because I'm going to learn more, not just for myself, but to be able to educate my mother, my sisters, and, all my female friends, so as to stay safe and healthy from the breast cancer stuff. All right, so let's go straight to the point. Now, October, as we all know, is dedicated to breast cancer awareness, and you've associated pink color to that. First and foremost, why the pink color? Why do we say Pink October? Let me start from Alison.
Okay, so I was also curious about this.
Okay.
So I was searching, I think somewhere last year or 2 years ago, why pink, and of all colors, why pink? Then I read that I think the first survivor of breast cancer was, I think it was 1990 thereabouts. She decided to start this whole Pink October movement. So she chose pink, mostly because at the time it was assumed that it was only women who had breast cancer. So pink symbolizing for women, and then I understand that it's also a color of hope. So it's giving hope to breast cancer victims, and not to say that once you're diagnosed of breast cancer, you're going to die. So in as much as it's a color of hope, it's also to symbolize that breast cancer exists and that there is hope for those who will be diagnosed of breast cancer.
Wow, so it is not just any color that was picked randomly. It has a meaning. It symbolizes something. All right, that's great. All right, now let's move on to what at all is breast cancer. You'll be surprised that there are some ladies or people watching us right now who have no idea of what breast cancer is. So let me move on to Dr. Cassandra. What is breast cancer?
Okay, so cancer is the growth of any abnormal cell uncontrollably, which can grow beyond their boundaries and then affect other organs. So when we say breast cancer, it is the growth of those abnormal cells in the breast which can spread to affect other organs.
Wow. Okay. So how do we expose ourselves to this breast cancer thing? Okay.
Okay, you want me to take
yes,
that?
Yeah, you
okay,
take that
so
for me.
I presume you're asking what causes breast cancer.
Causes?
Well, for like,
okay, no, let me ask, how do we expose ourselves? Let me take something like pneumonia, for instance. If I hear, I don't know whether it's medically proven, that if you sleep under a fan or in a cold area, you expose yourself to getting pneumonia.
Okay.
With breast cancer, how does it work? Yes.
Okay, so just like any other cancer, there is no particular cause that this made you get breast cancer, but there are other factors that could put you at risk of getting breast cancer or increase your risk of getting breast cancer. First of all, the fact that you're a female alone puts you at increased risk. I must add that even though men also get breast cancer, which I was going to ask that a lot of people don't know, men do get breast cancer.
Hey.
Men do get breast cancer. We had a case like that about 4 years or 5 years ago at the hospital, and I think that it has reoccurred in the other breast for a man. Yes.
Wow.
Yes.
Wait, so let me ask you, the men, no? See, some of so the remember the breast cancer now, you see, is it the muscular? Because I know we have breast, but we have So men who actually have their breasts out like women, is it them?
No,
that you're
so
talking
this
about,
particular
no?
patient is not
Okay.
like the type you are talking about.
Okay.
He's a normal man.
Okay.
Normal flat breast
No.
like you see any other man having.
Oh.
But you see, we all produce the same hormone, but just that the hormones in the men are way lesser
Yeah.
than as compared to the women. So it puts you at a lesser risk. So you are looking at just 1% of the male population getting breast cancer compared to 8 out of every 10 women who can get breast cancer. Okay, so just being a woman is one risk.
Okay.
Again, we can talk about age.
Okay.
So the older you are, the higher your risk of getting breast cancer. Now, we are a bit skeptical talking about this because you've seen younger people getting breast cancer now. Throughout this year, I've seen 34-year-old, I've seen 33-year-old, I've seen 60-year-old, I've seen 62. So I've seen both areas. So we can't say that it's so common in 55 and above because we've seen both, sides having quite a number of frequencies. So age exact is also another point. And we talk about those who have early menses, late menopause, and then those on combined oral contraceptives. I'm putting all these together because it's a hormone that plays a role in all of this,
Yeah.
the hormone estrogen. Okay, if you're exposed to, I won't say excess amount, but prolonged exposure to that hormone increases your risk of getting breast cancer. So if it's responsible for menstruation and all of that. So it means that if you have your menses early, it means you'll be more exposed to the estrogen. If you have your menopause late, it means you'll be more exposed to the estrogen. And again, the combined contraceptive pill, it has both estrogen and progesterone. So it increases your exposure to estrogen. That increases your chance of getting breast cancer. Again, if you have a family history, maybe your mother, your grandmother, your maternal auntie, if it runs through the family, you have an increased risk of getting it. Also, if you have a personal history, so maybe some years back, you had breast cancer, you've gone through the treatment, you might have done follow-up, you may not have done follow-up, you have a risk of getting it in the other breast. I have a patient right now who had that 20 years ago. She did breast cancer, gone through all the treatment, she reoccurred again this year. She's done the surgery, she's yet to start chemotherapy and the rest. So once you have a personal history of breast cancer, it puts you at risk of getting it again. Those are uncontrollable risk factors.
Yeah.
The ones you can control, you're talking about alcohol, excessive alcohol intake, smoking, obesity, all those things also contribute to increased risk of getting breast cancer.
Wow. Charlie, we must really pay attention to this breast cancer stuff. It's not just in women, Charlie. I'm shocked hearing that it also affects men. So this topic, Charlie, don't exempt yourself at all because you feel you're a man. It's for everybody. And so the link has been shared. We are streaming live on Facebook and on Twitter as well. So get involved, put together your questions, send them in, and we ask them so that whatever you need clarity on, you can get it and live a normal life. All right, so let me come to Dr. Cassandra. Now, how deadly is breast cancer and why must we take it serious as individuals?
Okay, so before we talk about that, let me just expand a little more on what Alison was saying.
Very well.
With respect to the increase in age that puts you at risk of breast cancer. So generally, globally, we say above 50 years is what puts you at risk. But in African women, we've noticed that less than 50 years, a lot of women are developing breast cancer.
Yeah.
And it's not just because of the fact that they are female. About 5 to 10% of cancers, we notice that there's a mutation in the gene when they are born. And it's medicine, we call the BRCA1 and BRCA2 genes. BRCA1 and BRCA2 gene. So about 5 to 10% of women develop that gene and puts them at an increased risk of developing breast cancer. And then also for the early menarche, so the early menses, usually put the age below 11 years. And then for the late menopause, we put it above 55.
So Doc, you are saying that if I should, not me, but if any lady should experience early menses, there's a high risk that the person is exposed to breast cancer.
Yes, that's the reason that Alison gave. That is the exposure to the female hormone, which we call the estrogen. So the earlier you have your menses below 11, it means that you're going to have a longer period where you will have that hormone in your body, and then you're at increased risk of developing a breast cancer. All right, so to talk about the prevalence of breast cancer, globally We say that about 2.1 million women every year develop breast cancer. That's according to WHO 2018. And out of these, they say about 15% of all cancer deaths comes from breast cancer. But according to the African Globacon 2018 documentary, it stated that though breast cancer is now the leading cause of cancer amongst women, cervical cancer is the leading cause of death from cancer amongst women, and breast cancer follows that. So more people get breast cancer, but not more people die of breast cancer. The survival rate is quite high. It's put about 90% of women have a 5-year survival rate that is better with breast cancer.
So why must I take this seriously?
Okay, so the important thing we need now is to be able to detect it as early as possible. It's the early detection that helps us to treat you properly, and then we can improve your outcome and the survival that you have. In Africa, it is because we present quite late. We notice something and then we are hoping to do some herbal treatment or something to be able to get over it. But the earlier you report with something that you have noticed that is different about your body, then we can detect it and then treat it and then improve the outcome that we'll get at the end of that.
Wow. So in Ghana, do we have any stats on number of women who are infected every year? I mean, here in Ghana.
So Ghana, we don't have a lot of data. We don't have so much data, but I think Kolebu had this documentary in 2018 that states that they are recording more breast cancer cases in younger women from 2018 till date. But as at 2019, 2020, we don't have any particular data that has been put out for Ghana for that.
We will come to symptoms and how to treat it, but if such a serious thing like breast cancer, if Ghana doesn't have stats on it to know the number of women that are affected, how many are treated and that stuff, you think as a nation we are taking this breast cancer thing seriously?
So yes, we are taking it seriously because we want to be able to improve the outcome of people who get it. We just want people to know that once you get breast cancer, it doesn't mean you are going to die. It's not a death sentence. There is treatment that we can offer to you. You can be cured of breast cancer and still live your life to the maximum age that you have to live to. It doesn't mean that when you get breast cancer, that is the end of the road. No, yes, it can recur, but once we're able to find it out early, and then we can take appropriate action and then improve your outcomes.
So to add to what she's saying and then to the statistics, the problem is, you know, different people or different centers are handling breast cancer cases. So we don't have a common coalition point to say that maybe we at Trust Hospital, we've seen 15 cases this year. We've entered into a certain database. Those are Kolebu have also entered into a certain database. Those are Confanoche have also entered into a certain database. So when you get into that database, you're able to see
exactly
all of that. So I think last year or 2 years ago, those are Kolebu were trying to find ways around putting data together so that we can have accurate data here in Ghana. So I'm sure it's in the pipeline. Maybe very soon, the pipeline will not choke.
This pipeline that keeps choking anyway. Wale Singh has said that the pipeline will not choke. So let's wait and look at this now. Okay, so how will I know that I'm experiencing breast cancer or the symptoms?
Okay.
Yeah.
So most of the time,
you take some part and then Dr. Cass also come in.
Most of the time, the first point or the first time people report to a hospital because they have found a lump in the breast. So, but it doesn't mean that all lumps are cancerous. There are some that are benign. You take it all out. You don't need to go through, chemo and all of that. You're just taking the lump out. That's it. So first of all, a lump, it may not be visible as you look at the breast, but you feel it when you, palpate the breast. That's why we advocate on self-breast examination, because sometimes it's so tiny. If you don't check your breast, you won't feel it. By the time you realize it's grown bigger and it might have started spreading.
But is there not a lump in the breast already? When you press your chest, don't you feel a lump there?
Okay, so the reason why we center on self-breast examination, everybody knows their breast better.
Okay.
So when you come to the hospital and I feel your lump, your breast, and I feel something in it, it may be abnormal to me because it may be an unusual lump. But you know that this is how my breast feels. The breast is a fibrous tissue, so once you feel it, it's not smooth all around.
Yeah.
But as much as or as often as you do the self-examination by yourself, you know how your breast feels, so you're able to pick up any unusual lumps in the breast. Okay. We can also talk about asymmetry.
Okay.
When you're talking, everybody has one breast slightly bigger than the other.
Oh, really?
Yeah,
Okay.
everyone has one breast slightly. I'm emphasizing on slightly. But if you realize that one is significantly bigger than the other, it means it wasn't so previously. You have to report to the hospital for further investigation. Again, if they see any skin changes, maybe some parts of the skin is getting lighter than other parts of the breast, you have to bring it in for examination and further investigations. You also look at dimpling in the skin. You see the way the orange peel looks like?
Yeah.
Acentochrome, small holes in it.
I've seen that.
You look out for that as well. If I think I've seen people with that naturally, but it's not common. So if your breast wasn't like that and then you've seen that all of a sudden you are dimpling in the breast, you have to report to the hospital. It may not be breast cancer, but don't sit at home. Report to the hospital, and then I'll leave the rest for doctor.
Okay. So doc will
okay. So she mentioned quite a number of them, but the few things that I'll add is the pointing of the nipple. Okay, we expect the nipple to point outwards in the normal breast.
Yeah.
But if there's a development of a cancer, we notice that most nipples tend to point inwards. So if you see any of that kind of change, then you have to report to us.
Your nipple can go inwards?
Yes, so we call that a nipple retraction. It's being retracted into the breast. Okay, and then also some people get a discharge from the breast, which may be bloody or milky. Any sort of discharge that you see, you just need to report for us to take a look at it. And then there's one more thing. Okay, I just blanked out. So, okay, yes, I remember. So, most breast cancers are painless. Okay, but occasionally some people do develop pain. So don't say you've seen a lump, but you don't feel any pain, so you wouldn't report with it. By the time you start experiencing pain, then you have gone into an advanced stage where we cannot help. So any kind of lump that you find, whether there's pain associated or not, try and report, and then let's take a look at it.
All right, so if you just joined us on Facebook or on Twitter, you can share the link so that your friends and family can also join in the conversation. You can send your questions down here and we ask them for you. All right, so let me read some few comments from Facebook and some questions as well. Afia Florence is asking whether it is normal to feel a sharp pain in your breast without touching it. The pain normally lasts for some few seconds. Is it normal? Is it normal thing to feel a sharp pain in your breast once a while?
So it depends on the timing of her menses. If she's having the pain now and she's just completed her menses, we cannot say that is an abnormal kind of pain. So far as she's had pain, she should just come, we'll examine her, take a good history, and then have a look at it, and then we'll give her a better understanding of whether that is something to be concerned about.
Okay, all right. So does diet affect, or does diet expose one to breast cancer, what you eat?
Yes, it does. So like Alison mentioned earlier on when we talked about the risk factors, obesity is one of the main risk factors that increases your chances of getting breast cancer. So now we tend to eat a lot of things that contain a lot of fats, a lot of things that are processed. All those things tend to increase our chances of getting breast cancer, and also because of the fact that we are not exercising as much as we have to, we are developing more, we are getting more overweight and more obese, and obesity is also linked to you having more of the female estrogen hormone, which puts you at increased risk of breast cancer. So yes, our diet plays a big role in us developing breast cancer.
You made mention that your family lineage or genes can also affect. So the fact that my mother or an auntie of mine has breast cancer, must I be alarmed? Must I panic?
You shouldn't panic, but you should do frequent hospital visits, or and you have to do the self-breast examination all the time. because as Dr. Cassandra has said, the key point here is early detection. It means your risk is increased. You have the gene that could get you that can make you get breast cancer. So it means you have to be on the lookout all the time. It doesn't mean that everybody who has had a family history would get breast cancer. You just stand a higher chance. So be on the lookout, always examine yourself, do your routine checks when you have to do every year checks or every 6 months as scheduled by your doctor. You have to go to the hospital frequently for all of that. So you don't have to be scared, or you don't have to panic, but you have to be on the lookout for any unusual things around the breast.
Yeah. So let's come to the treatment. More often than not, what we see on TV is that whenever there's a picture of a woman who is infected with breast cancer, we see the breast being cut off. Those are the pictures we see all the time on our screens. And so when you mention breast cancer to anybody, the fear is that if I get infected, my breast will be cut off. Is that a situation? What are the treatment, or how do we treat breast cancer, and whether the cutting off is the only solution to it?
Okay, so, there are various treatment options. Okay. I'll just mention and then she'll go into more details. Very well. So there's surgery, and the surgery is not necessarily cutting off the whole breast. That again will depend on the point at which you reported to the hospital and the part of the breast that has been affected. She'll throw more light on that. There's chemotherapy, there's radiation therapy, and there's hormonal therapy. So these are the 4 treatments available here in Ghana. Okay. I'm sure maybe outside they would have explored other
alternatives.
Yeah, exactly. Yeah. So right. Dr. Cassandra can give us more details on the
Yes, so like Alison has said already, it depends on when we detect the breast cancer. So if you come at an early stage and then we find just a localized lump, it is easy for the surgeon to go take out that lump and then leave the rest of the breast. Okay, and after that we may process you through other treatments, like she said, chemotherapy, radiotherapy, depending on the staging of the disease. So when you come, we do a certain workup to be able to identify how far the disease has gone. If it is not too far spread, we can take out that lump, and then we screen you on about a 6 monthly to yearly basis to find out any recurring lumps that we may pick up. But for people who tend to present late, okay, depending on the size of the tumor, you may have to go through a chemotherapy session for about 6 weeks before we can go in and then do the surgery and take out the lump or take out the breast. For some people, okay, in the Western countries, there were studies that show that many people were coming in for bilateral mastectomies just so they could avoid any recurrence.
If you can throw more light on that.
Okay.
Bilateral.
Okay, so removal of one breast means mastectomy. Okay. Bilateral means 2 breasts that have been taken out. Okay. They found out that people who had breast cancer in one breast wanted to take out both breasts so that they get rid of any chances that they may have of any recurrence. But in Ghana, most people, we adore our breasts, yes. Although now there are prosthesis. Prosthesis is an artificial implant, okay, of a breast, which you can use once your breast has been taken out.
And it's done in Ghana?
Yes.
Okay.
You can still live your life as normally as possible. Some people also have to go through radiation therapy, that is using sort of like X-rays to be able to shrink out the tumor and then be able to take out as much of what is there that we can take. Like we know, the cancer spreads into the armpit as well, which there are some lymph nodes there that you can take out the breast, and if those lumps are still there, you can still have the cancer spreading. So all those treatment modalities that are there are just to find out any little cancer spreads that may be there, and then provide as much treatment so that we don't have any form of recurrence of the breast cancer.
All right, so let me read some few questions on Facebook, and then we'll come back to how expensive breast cancer treatment is in Ghana. All right, so the question is, Nana Ama Brewer Champion is asking, does family planning methods contribute to breast cancer?
Yeah.
Yes, it does.
Okay.
Yes.
When I was talking about the contraceptive,
yeah.
the combined oral contraceptive, that also puts you at risk because of the inclusion of the estrogen in that. That's a form of family planning method. So that could increase your risk of getting breast cancer.
Yeah. Okay. All right. So if you have any questions, you can send them into the Facebook page, or even if you're watching from Twitter, you can send the questions there, and then we will ask them for you. Please don't just watch it. Make sure you have all the understanding you need, because when this opportunity comes, you grab it and you move along with it, so you prevent, Charlie, the breast cancer issues. All right. So how expensive is it to treat breast cancer in Ghana?
So yes, it is quite expensive, especially because of the other treatment modalities that we have to go through, like the chemotherapy, radiotherapy, hormonal therapy. I cannot put a figure to it, but we've noticed that most people, once they come for the screening, they pick up the lumps. We lose them to follow up because they cannot afford even the mammograms that they have to do, the scans they need to do for us to be able to identify how far the disease has gone and to be able to treat them appropriately. So it is quite expensive for the average Ghanaian, but that's why at the Trust Hospital we have offered a 50% discount on all the scans you need to do, mammograms, in this month of October, that you can come for us to do that for you, and then we can treat you.
All right, so we will come to what the Trust Hospital does in helping breast cancer. But so if it is very expensive, then it means that once one is infected, what do we do? Do you leave the person to have faith? Because how do I go on with the treatment?
It is quite difficult, but we keep advocating for support from other groups.
But is there any fund in Ghana, like the breast cancer fund, where when you have people with infections who cannot afford it, you dip, or you go into the fund to help people like that?
I cannot ascertain that, but there are individuals who tend to raise funds. So there are people who have had breast cancer in the past who tend to raise like a sort of foundation, tend to raise certain funds for people who may need assistance in providing treatment. So there are centers that you go, and then they can direct you to the appropriate sources where you can get a bit of funding and to help with your treatment.
So where can I get screened for breast cancer?
You can come to the Trust Hospital. We do screening for the general public on Mondays and Wednesdays at our Trust Specialist Hospital at Osu for free.
Mondays
and Wednesdays. We do free breast screenings.
Okay.
Mondays and Wednesdays from 9 o'clock in the morning.
Is it only in October that you do that?
It's only in October that we do the free breast screening. Outside October, we have the wellness clinic or the Well Woman Clinic, where we do breast checks, cervical cancer checks, and all of that. So that is done on Tuesdays and Thursdays. So even now in October, we do the free screenings Mondays and Wednesdays. Then the Well Woman Clinic still holds Tuesdays and Thursdays in the afternoons at the Trust Hospital. So you can walk in, get your checks done, but take advantage of the free screening that's going on at Trust Hospital at the specialist branch in Osu.
Okay. So apart from Osu, is there any
we will be going to our clinics, our satellite clinics. We have Tema branch, we have Adenta, we have Dome, Dansuman, and Pension House. So we have scheduled dates for all these places. So in case you live close to the places I've mentioned, just look out for the information as to when we will be visiting those satellite clinics to do the free screenings as well.
Very well. In terms of the treatment, do we have any herbal treatment for breast cancer victims?
Okay, so we have no documented herbal treatment that has been found and proven to treat breast cancer. What we know are the orthodox medicine that we are talking about, including the surgery, the chemotherapy, radiotherapy, and hormonal therapy.
So anyone who claims to have a herbal medicine to curing breast cancer might not necessarily be telling the truth?
Well, they may have to go for authorization from the Food and Drugs Board. As now, there's no documented evidence of herbal treatment.
I want to add to what she's saying. Mm-hmm. Over the years, we've had patients who had come in the later stages where virtually nothing can be done for them because somebody told them, oh, quite they had been better to swallow. And they have one 34-year-old patient like that. It was detected very early, but her auntie advised her, oh, by the abetiti habai atutu. So when she came, you can't stand the smell of the breast. So it comes at a point where you can't do much for the patient. So I advise that once you detect a lump, please stop roaming. Come to the hospital. Come to the hospital. If you can, early detection has saved a lot of lives. So, like doctor said, there hasn't been any documented herbal treatment that has been said to cure any breast cancer. But we know of documented orthodox treatment that has cured thousands of people. So please come to where the document is. Don't be roaming.
And be safe. All right. So a few questions here, and then we move on with the questions. Nanama is asking, how about the family planning implants? Is there any implants? Family planning. She's asking whether that can also cause breast cancer.
What we know is the combined oral pill. If there has been any studies done on the implants, those ones do not contain estrogen. So I doubt, but like I said, what we know is the combined oral contraceptive, because it has estrogen. And the other ones have just progesterone, I think. Yeah.
Okay. All right. From which age can you start examining your breast?
So, like we said, now we are picking women even less than 50 who are developing breast cancer. So any child, once you've started your menarche, like we said, any child from the age of 11, 12, we can teach you to examine your breast. You examine your breast after your menses. Most times we say about 7 to 10 days after your menses. We'll teach you how to examine it. Like we said, Alessa said earlier, you know your breast. So as often as you can do it, no matter how old you are, you can always learn to examine your breast.
All right, so another question is coming from Nana. She's asking, can wearing bra for long hours cause breast cancer? Wearing a bra for long hours.
We'll get to that when we get to the breast care portion.
The breast care portion. Okay. All right. Okay. All right. So with that, let's go to the breast care portion, and then let's talk about how best we can care for our breast.
Okay. So I'll talk about how to do the self breast examination. Then she'll talk about other breast care issues. So the self breast examination is quite simple. We teach every woman to do it every month after her menses, so that you get to know your breast. So as soon as something comes in, you pick it up quickly and report to the hospital. So I'm sure we'll play a video that would and highlight all of that.
Sure.
But you do observation first before you feel for the lumps in the breast. The observation, you're looking out for the other signs and symptoms we mentioned to you: the change in color of the skin, the asymmetry of the breast, the retraction of the nipple discharge, and all of that. That's what you're looking out for when you are doing the self breast examination. So you stand in front of a mirror with your naked breast showing. You look out for all these signs. You look at the sides as well, not just the front, because most of the time some people don't see the size of their breast, but the mirror will help you to see the size of your breast. So you do that, and then you do the palpation. We'll teach you in the video how to go around the breast every month. You can do it better when you have a bit of soap in your hand. So you can do it in the bathroom when you're going to bath, whilst you're lying down, whilst you're standing or sitting. It can be done, and it takes barely a minute to do that. So we advise every woman to do it every month. See, some people even do it every day. Nothing's full. So once you're in the shower, you can just take advantage of it and examine your breast. So we'll play the video. You see how simple it is. Dr. Odum will take us through the other breast care.
So as a man, do I also do same? Do I also stand in front of the mirror, go around?
You can. The easy thing with men is most of the lumps are visible because you don't have lumpy breast like women. So once you feel the lump, it means you can actually see the lump in the breast. So you can also do that.
Some have flatter spine, they can't even see that. They can't even see their breast.
That's what I'm saying, that it's easy for them to even notice a lump.
There to press. There'll be nothing to press. I don't want to mention names. You said husbands can also do. Okay.
Like I said in the video, most of the time when women come to the hospital, like, oh, my husband noticed the lump in my breast, and one woman came with her husband, and the husband was telling us that it wasn't there. That thing wasn't there. All of a sudden, then it came. So he was telling her he's been feeling this for her, but he didn't feel any lump, but all of a sudden he felt a lump there, and then he came to the hospital.
So it's only husbands who can do that thing.
Oh, of course.
I'm only asking for my friends. So.
Only husbands.
Only
you don't
husband.
want trouble.
All right.
You don't want trouble.
All right, so let's move on to the next treatment. Dr. Cassandra.
Other breast care.
Okay, so the last portion we need to talk about is the breast care.
Okay.
Those are things you can do for your breast to ensure that your breast is healthy throughout your lifetime. So the first point we'll talk about is get a good tight fitting bra. Okay, there are so many lingerie shops that you can go to. They'll measure the size of your torso and then use that to decide what size of breast cap you need, and then get you a good fitting bra that you can wear throughout the day without causing you much discomfort. Okay, the other thing we'll talk about is the kind of creams you use on your breast. Okay, we don't like people who use bleaching creams and creams that we cannot ascertain what is in the cream. So we advise for shea butter, Vaseline, the normal creams that you use for your body. Okay, the other thing is when you bath, okay, there are people who have quite big breasts. We advise that when you clean, you have to clean beneath the breast as well. The dampness causes fungal infections and things that we don't advocate for. So we expect that when you clean, remember to clean beneath the breast as well. We advise that when you're going to bed at night, okay, free the breast. There's no need to wear
free
a bra.
the breast.
Free the breast.
There's no need to wear a bra at night.
Don't
No
put
prison.
the breast
They've
in
been
Free
in
the
prison
breast.
the
Let
whole
them
day.
be free.
Oh,
Okay, there's no point in keeping the breast in the bra while you're asleep.
But
okay?
when they feel that when you free the breast, when you free it, does it get long? As in, does it?
No. So that's why we have said that you get a good tight fitting bra throughout the day.
Throughout the
that
day.
keeps that shape that you are looking
So you
for.
only you free it in the night when you're going to
breast.
sleep.
Yes, free the breast at
Because
night
as
and
much
let
as
them
you are
free.
putting on the brassiere, we
Yeah.
need to enhance circulation to the breast.
Yeah.
So if you are putting on tight brassiere to sleep, means that you are impeding circulation to
Yes,
the breast.
and that's going to occur for 24 hours, 7 days a week, which is not necessary. Okay. Yes, so I think that's about the breast care tips that we'll get
All
to.
right. Okay. That's very good. Now let's talk about the awareness creation. The Trust Hospital, you're doing great with the awareness creation in October and all that. Is it? I know you are doing your best in Accra, right? Or you go out outside, because
No.
you know in Accra, anya bibi befa obi asunwate, but the very people who fall victims are people in the rural areas, the northern zone, those people that do not even have access to TV and radio. I mean, for now, people can log onto Facebook and watch this and get educated, but over there, they don't even have phones. So, what are you doing to make sure that the awareness creation is not only centered in Accra?
Okay, so plans that we have made have not gone so far advanced into the other regions. For now, our focus is on Accra. Hopefully, maybe next year we can look at that and then provide other means by which we can reach people in the districts. But for now, our main source of communication is through the radio and through the
Social
TV.
media.
Yes, social media. That's how we are reaching out to everybody, so that if you find anything, you can report to any health center close to you, and then they can refer you appropriately if you need to be referred.
And I must advocate that
Okay.
as much as we are here doing it in Accra, even if we want to spread to other regions, we can only do so much. So I advise our colleague doctors and nurses who are in the other regions to also take up the fight against breast cancer. If they are making as much noise as we are in Accra, in those other regions they find themselves, I think that together we can achieve a more national aim of reducing the breast cancer incidence in Ghana.
Speaking of national, is this breast cancer a national fight? Because I can see the Trust Hospital is a private hospital, right? Is it a national fight? Is the government, again, let me go back to the government, is the government putting in effort to make this a national fight by empowering some of these, whether private or public hospitals to make it one huge agenda, where you see how this coronavirus came and everyone is involved with statistics out there. Everyone feared I was going to die when I get in touch. You think it should be made a national fight so that we all get involved?
Yeah, I think so, because as we were saying earlier, the fight shouldn't be centered in Accra, because we get people from the rural areas coming or being referred to Accra. I think so far the biggest centers are Kolebu and Konfanochi.
Okay.
Those are the centers I know that treat breast cancer cases. So it means that if there are other facilities all over the place, or they make this a national fight and the government puts in a lot of money to be able to encourage people to report or give subsidy for the treatment because they are expensive, I think that we would cut across a larger group of people, and then we'll be able to win this fight against breast cancer.
All right, thank you very much. We're just running out of time, but now let's talk about your activities for the month of October. Now you are on a social media tour, right? All right, so what other activities are left for you in the month of October?
So we have a few webinars that we'll be doing. I think the next webinar will be coming up on the 15th of October.
Webinar.
Yeah. Yes.
What's that?
That's like a teaching series.
Okay.
Over the internet that will be done by the.
Okay, like a seminar, but you're doing a webinar.
Yes.
Right. Okay, that's fine.
We have a few webinars that we are doing, and then like Alice had said, we are inviting groups to come to the hospital, the Trust Specialist Hospital, for the screening exercises that we are doing. And then also we'll be visiting the satellite clinics and then offering the services there as well. So if you live close by any of those satellite clinics, you can come by and then we'll offer the service to you.
All right, thank you very much, Dr. Cassandra. Please put the venues out again, the venues for the free screening.
So our Trust Specialist Hospital branch in Osu, we do the free screenings on Mondays and Wednesdays. From 9 o'clock in the morning.
Okay.
And then we put out the days and then the times for our other branches, that is Dansuman, Tema, Dome, Adenta, and Pension House. We put them out later. So along the line, when you are having your shows, we can let you know so that you tell them to visit those clinics for us to do the free screening for them.
All right, thank you very much. Alison Namate is a nurse from the Trust Hospital, and she's part of the Pink October team, and also having Dr. Cassandra Odum, general practitioner, also from the Trust Hospital. Thank you so much for your presence here. Like I said, the men, we've not been left out. We thought it was just for women, actually. If I go home, I stand in front of mirror, raise my hand, start the do round. I'll make sure I do that almost every month, because Charlie, this thing there, I want my two breasts to be intact. So definitely. All right. So your final words, and then we can wrap up. Your final words.
Okay. So my final thing I want to say is, detecting breast cancer early increases your chances of survival.
Right. So you can look into the camera.
Okay. So don't be scared when you're diagnosed with breast cancer. Once treatment is commenced, do well to follow through, because if you start one part and stop the others, you've virtually done nothing. So once you're diagnosed, don't be scared. There's a lot of hope for you to increase your chances of survival.
I don't. Yeah.
And I want to talk about the fact that this year the theme that globally we are celebrating is detect it, treat it, and defeat it. Breast cancer is defeatable, so come as early as you can, and then let's help you when we detect your cancer.
All right, thank you very much. It's an honor to have you two right here for the education.